Hello, I'm Lori Thompson, and my speech is titled Pharmaceutical Companies, Chemo, and Cancer. Is Cancer Too Big a Business and a Forgotten Cure? 20,000 people will die today from cancer. 20,000 people die each and every day worldwide of cancer. There are over 1 million new cancer cases diagnosed each year and over 500,000 cancer deaths in the United States alone. Take a look at this chart behind me of the top 7 pharmaceutical companies and their 2014 revenue dollars. In the number 1 position is a Swiss corporation, Novartis, coming in with $51,307 million in revenue in 2014. Pfizer is next with over $44 billion, and Merck & Company comes in 5th at $36 billion. A large percentage of each of these companies' revenues comes from the sale for their chemo drugs. Cancer is big business. Now I ask you, is it logical to think that any one of these companies would be willing to sacrifice a decrease in these revenue dollars to find a cure for cancer? Cancer is big business. Dare say, too big for a cure. On July 9th, 2015, I was told that the biopsy was positive for lung cancer. My doctors were optimistic because we'd caught it early, and my first step was a lobectomy to have the upper left lobe of my lung removed. This was done August 9th. And afterward I was told that several lymph nodes had been removed during surgery to be tested for cancer. Several weeks after surgery, I was referred to an oncologist who scheduled me for a PET scan. And after my PET scan, I was told that my lymph nodes had come back negative, and my PET scan had come back clear with no signs of cancer. However, the oncologist recommended that I do 6 sessions of chemotherapy. And when I asked why, he said, "Off the record, are you asking me if there are people who are receiving chemotherapy that do not need it? Absolutely yes, there are. But the problem is we don't know who needs it and who doesn't." The reason I was given that they don't know who needs it and who doesn't is because cancer cells are microscopic and cannot be seen until they form a mass. I found it hard to believe that science can break down human DNA to 99.999% accuracy, but cannot invent a machine to see a microscopic cancer cell until it's formed a mass. According to the film documentary Cancer: The Unforbidden Cures, it is not unusual for a new patient to be given 6 to 12 months of chemotherapy as part of his or her initial treatment. In my case, I opted not to take the chemo, based on no evidence of cancer in my body. With 1 million new cancer cases in the U.S. each year, is chemotherapy really that beneficial? Professor John Cairns from Harvard University published a study in 1985 in Scientific American concerning the benefits of chemo drugs, and he stated, quote, "Aside from certain rare cancers, it is not possible to detect any sudden changes in the death rates for any of the major cancers that could be credited to chemotherapy." In 2004, an Australian group of researchers came to the same conclusion. They found that chemotherapy's contribution to the 5-year survival rate in adults was 2.1% in the U.S. and 2.3% in Australia. So why then are we continuing down the chemotherapy path? Why aren't we doing something different? The American Medical Association has not changed their standard of treatment of cancer in over 40 years. It's been surgery, chemo, radiation. And the National Cancer Institute's website discourages patients from alternative therapies for cancer as being unsafe and claims little is known about them due to problems finding institutions and cancer researchers to work on them, as well as citing time and funding issues. Given that what we've been doing has not been working for over 40 years now, isn't it time to invest more, if not all, research dollars into alternative therapies? The National Cancer Institute and the American Medical Association just continue going along with the big business of chemo drugs and lining the pharmaceutical companies' pockets. Cancer is big business. Of the 1 million new cancer cases each year in the U.S. alone, the average cost per patient is $50,000, which translates to $50 billion in the U.S. alone in 1 year. Cancer is big business. British research reveals that Gleevec, used to treat certain kinds of leukemia, true cost for 1 year's supply is $159. But the price for a year's supply in the U.S., it's $106,322. In the United Kingdom, it's $31,867. Cancer is big business. Dr. Peter Balk of Memorial Sloan Kettering Cancer Center in New York has documented nearly a 100-fold increase in cancer drug prices since 1965 after adjusting for inflation. Dr. Balk says, quote, "The rate of rise exceeds the rise of benefits from these drugs," end quote. The National Cancer Institute states that medical costs of cancer care are $125 billion and projected to be $173 billion by 2020. As you can see by the list of top 7 pharmaceutical companies' revenues for 2014, there's not much incentive for the pharma industry to invest any money in researching for a cure for cancer when their annual revenues would be cut by billions of dollars. I don't know of any time an industry would be willing to give up billions of dollars in revenue for anything. The monopoly held by the pharma industry came about during the 1990s, when most research dollars were diverted from grants given to universities which conducted unbiased scientific research and were diverted to the for-profit research organizations that exist only to serve the pharmaceutical companies. This diversion that took the funds from the universities to these research organizations allowed the pharma companies to take total control over the research, keeping unfavorable results and alternative medical therapies from being published. Clearly, we need to get the research dollars back in the grants to the universities and out of the hands of the pharma industry. The pharmaceutical companies have gained far too much power, and it's time we put an end to their control over the research being done for cancer. We cannot sit by and watch our mothers, fathers, sisters, brothers, sons and daughters, grandmothers and grandfathers, aunts and uncles and friends all die of cancer while the pharmaceutical companies' revenues continue to grow well into the tens of billions of dollars. More research dollars needs to be used to conduct unbiased research for cures for cancer. We don't need any more chemotherapy drugs. With markups from $159 to $106,000, the drug companies need to be harnessed with legislation and strict laws regarding funding research as well as federally mandated price increases. In closing, I would like to say that there needs to be a change in the way we as a nation and as a society treat cancer, because what we've been doing has not been working. There's 20,000 people who will die of cancer today. What we've been doing has not been working. Another 1 million people will have cancer in the United States alone by this time next year. What we've been doing has not been working. There will be over 500,000 people die of cancer by this time next year just in the United States. What we've been doing has not been working. In the 1970s, 1 out of 16 people had cancer. Now it is 1 out of 3. What we've been doing clearly has not been working. And when something doesn't work, we don't keep doing the same thing over and over, for that's the definition of insanity. When something doesn't work, we try a new approach. We try something different. We change the way we've been doing things. One such change, which should be immediately addressed, is putting the research dollars back into the colleges and the universities that are free to conduct unbiased scientific research with no accountability to the pharmaceutical companies. We can no longer allow the same research to continue, because the research being done is for more chemotherapy drugs, and they have not been working. Chemo does not cure cancer. There are some who go as far as to say that there are more people killed by the chemo drugs than by the cancer. It is past time we demand a change, because what we've been doing has not been working.